Welcome to today's video lecture on madeformedical.com. Today, we're going to delve into a fascinating topic in rheumatology: ankylosing spondylitis. This chronic inflammatory disease primarily affects the spine and can have a significant impact on a person's quality of life. So, let's jump right in and explore the key aspects of ankylosing spondylitis. Ankylosing spondylitis is a chronic inflammatory arthritis that predominantly affects the spine and sacroiliac joints. It belongs to a group of diseases called spondyloarthropathies. Now, let's discuss the clinical presentation, etiology, and diagnostic criteria for ankylosing spondylitis. In ankylosing spondylitis, there is an abnormal immune response characterized by the activation of T cells, particularly CD4 and CD8 T cells. These immune cells infiltrate the synovial tissue and entheses, triggering an inflammatory cascade. When an individual with a genetic predisposition encounters an environmental trigger, it leads to the activation of the immune system. In ankylosing spondylitis, there is a dysregulation of the immune response, particularly involving T cells and pro-inflammatory cytokines like tumor necrosis factor alpha, TNF-alpha, and interleukin-17, IL-17. The immune response triggers inflammation in the sacroiliac joints, causing pain and stiffness. Over time, this inflammation can spread to the spinal joints, leading to the fusion of the vertebrae. The process of fusion, known as ankylosis, results in a loss of flexibility and mobility in the affected joints, eventually leading to a stooped posture. Furthermore, chronic inflammation can also affect other tissues, such as the eyes, heart, and lungs, resulting in extra-articular manifestations in some individuals. While the axial skeleton is the primary target, ankylosing spondylitis can also involve peripheral joints such as the hips, shoulders, and knees, leading to peripheral arthritis. Additionally, enthesitis, which is inflammation at the site where tendons and ligaments attach to bone, is a common feature of ankylosing spondylitis. Ankylosing spondylitis is a complex disease with a multifactorial etiology. As future healthcare professionals, understanding the pathophysiology of this condition is crucial for accurate diagnosis and effective management. The clinical presentation of ankylosing spondylitis can vary from person to person, but there are common signs and symptoms that we look for when diagnosing the condition. Let's explore the typical clinical presentation of ankylosing spondylitis. Persistent lower back pain. One of the hallmark symptoms of ankylosing spondylitis is chronic and persistent lower back pain. The pain may start gradually and worsen over time. The pain is often worse in the morning and after periods of rest, and it tends to improve with physical activity. Stiffness and reduced mobility. People with ankylosing spondylitis often experience stiffness and reduced flexibility, especially in the morning or after prolonged periods of inactivity. The stiffness typically affects the lower back, hips, and buttocks. It may take time and movement for the joints and spine to loosen up and improve mobility. Sacroiliac joint involvement. Ankylosing spondylitis frequently affects the sacroiliac joints, which connect the base of the sacrum to the iliac bones. Inflammation in these joints can cause pain and tenderness in the lower back and buttocks. Sacroiliitis may be detected through physical examination and imaging studies. Spinal involvement. Over time, ankylosing spondylitis can lead to inflammation and fusion of the spinal vertebrae, resulting in reduced spinal mobility. This can lead to a stooped or hunched forward posture. In advanced cases, fusion may also affect the neck, limiting head movement. Peripheral joint involvement. While ankylosing spondylitis primarily affects the axial skeleton, it can also involve peripheral joints, such as the hips, shoulders, knees, and ankles. This peripheral arthritis can cause pain, swelling, and a limited range of motion in these joints. Enthesitis. Enthesitis refers to inflammation at the sites where tendons and ligaments attach to bone. In ankylosing spondylitis, enthesitis commonly occurs, leading to pain, tenderness, and swelling around areas such as the Achilles tendon, the plantar fascia, and costochondral junctions. Diagnosing ankylosing spondylitis involves a comprehensive approach that includes a combination of medical history assessment, physical examination, laboratory tests, and imaging studies. Here are the steps typically followed in diagnosing ankylosing spondylitis. Begin by conducting a detailed medical history interview with the patient. Inquire about their symptoms, including the onset, duration, and progression of lower back pain, stiffness, and other associated symptoms. Ask about any family history of as or other related conditions. perform a thorough physical examination, paying specific attention to the spine, sacroiliac joints, and peripheral joints. Look for signs of inflammation, such as tenderness, swelling, or restricted range of motion in these areas. Assess the patient's posture and mobility, including spinal flexibility and chest expansion. Although there is no specific blood test to definitively diagnose ankylosing spondylitis, certain laboratory tests can help support the diagnosis and rule out other conditions. These may include human leukocyte antigen, HLA-B27. HLA-B27 is present in a significant percentage of individuals with ankylosing spondylitis. However, it is not exclusive to ankylosing spondylitis and can also be found in other conditions. A positive HLA-B27 test result, in combination with compatible symptoms, can contribute to the diagnostic process. Acute phase reactants, elevated levels of C-reactive protein, and erythrocyte sedimentation rate may indicate the presence of inflammation in the body, which can support the diagnosis of ankylosing spondylitis. Radiographic imaging plays a crucial role in the diagnosis of ankylosing spondylitis. The following imaging modalities are commonly used. X-rays. Plain radiographs of the pelvis and spine can help identify characteristic findings of ankylosing spondylitis, such as sacroiliitis and spinal fusion. However, these changes may take time to develop, and early-stage ankylosing spondylitis may not be apparent on X-rays. Magnetic resonance imaging, MRI. MRI scans can be more sensitive than X-rays in detecting early signs of inflammation in the sacroiliac joints and spine, making it a valuable tool for diagnosing ankylosing spondylitis in its early stages. If ankylosing spondylitis is suspected based on the clinical presentation and preliminary assessments, a referral to a rheumatologist is recommended. Rheumatologists are specialists experienced in diagnosing and managing AS and other rheumatic conditions. They may conduct further evaluations, provide expert interpretation of imaging studies, and guide treatment decisions. The treatment approach for ankylosing spondylitis involves a combination of medication, physical therapy, and lifestyle modifications aimed at managing symptoms, reducing inflammation, improving function, and preventing complications. The treatment options for ankylosing spondylitis include NSAIDs such as ibuprofen and naproxen are often the first-line treatment for ankylosing spondylitis. They help reduce pain, stiffness, and inflammation. Higher doses or different NSAIDs may be prescribed for individuals who do not respond adequately to initial therapy. DMARDs, such as sulfasalazine or methotrexate, may be considered in cases where symptoms persist despite NSAID therapy. These medications help to modify the underlying disease process and reduce inflammation. Biologic agents, such as tumor necrosis factor alpha, TNF-alpha, inhibitors, for example etanercept, adalimumab, and interleukin-17, IL-17 inhibitors, for example secukinumab, are used for individuals with moderate to severe ankylosing spondylitis who do not respond adequately to NSAIDs or DMARDs. These medications target specific inflammatory pathways to reduce symptoms and slow disease progression. Referring patients to a physical therapist experienced in managing AS can be beneficial. Physical therapy aims to improve posture, mobility, and muscle strength while providing exercises and stretching techniques tailored to the individual's needs. Encourage patients to engage in regular exercise routines that promote flexibility, strength, and cardiovascular fitness. Low-impact activities like swimming and cycling are generally well tolerated. Emphasize the importance of maintaining an active lifestyle to manage symptoms and preserve joint function. Applying heat packs or taking warm showers can help alleviate stiffness and discomfort. Cold packs can be used to reduce localized pain and inflammation. In cases of severe pain or flare-ups, short-term use of analgesics or muscle relaxants may be considered to provide relief. Educate patients on maintaining proper posture and body mechanics to minimize strain on the spine and joints. Encourage patients to prioritize rest and ensure they have a supportive mattress and pillow to promote better sleep. Encourage patients to quit smoking, as it is associated with worse disease outcomes and reduced treatment response. And there you have it, an overview of ankylosing spondylitis. This chronic inflammatory condition requires ongoing management and a multidisciplinary approach to improve the lives of individuals affected by it. As future healthcare professionals, it's crucial to stay informed about rheumatologic conditions like AS to provide optimal care for our patients. And that brings us to the end of today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel Made for Medical on YouTube, and visit our website madeformedical.com for more content like this.